own contact trace investigation and figure out who came into close contact. So we've retooled our whole operation here. This morning we're running just the. I mean, everyone at KUAM is essential, but it takes 1, 2, 3, 4, 5, 6 people to put on this show and to put on the news. So we have totally scaled back. After we get tested today, you're going to need a negative test to enter the building if you're an employee. So, I mean, it really again is just a reminder to me of how interconnected we are, right? And that's why we have to be so mindful of our interactions, because they're not just our interactions. Whoever you guys interact with, that's who we're all interacting with. So when you guys go around, just be mindful of, you know, how much time and how close contact you spend with people who are not part of your household. And that's a key thing that we're hearing from public health. We're hearing it from the surgeon cell. We're hearing it from the governor's office, is that people from different households are mingling together without social distancing, without masks. And that's why we're seeing this rampant spread. And it's not just a cluster. I mean, it's like the whole island has become a cluster. And so emotionally, in dealing with this news that came down late Saturday evening, I just got to say, Bree, that you called your parents, right? You're on the phone with your parents. I put something in my family chat on Sunday, and I was like, you know, we have a positive case at work, and you know, guys, we're going to all go get tested tomorrow. And, you know, I mean, there's really nothing we can do now, but, you know, just appreciate your prayers. And my mom put, okay. And my cousins put, yeah, okay. Like, what? But, you know, my kids called, and, of course, they were really concerned, especially my little ones. They take this so serious. Bree, and I know you had a moment yesterday where, I mean, this is hard to unpack, because I feel like we've navigated this pandemic with our center being, how do we protect ourselves and how do we protect each other from the spread of this virus? So this was a big deal, obviously a big deal for you, Bree.
Yeah, it definitely was. I think when we went into PCOR 1 the first time, you know, we had put in all these precautions for our staff, and you know, for me, it just really is. It is so hard, because I'm so concerned about everybody that works here. So all I can do is pray that everybody's all right. And we have disinfected our entire office. That was actually already previously planned, and we are disinfecting our office every Friday going forward. We are on bare minimum staff here. And all of our staff will get tested. I mean, to ensure that you should.
Nah, Bree. I mean, I told you. You know, Sabrina. She is really the best, most compassionate boss. I mean, she was just on the phone with everybody. You know, we had a big meeting yesterday, and you know, guys, Sabrina feels like this is, you know, partly your fault, and we spent a lot of time yesterday just. It's not your fault. I mean, we all were trying to figure out when was the right time to pull back operations in light of, I mean, we were still in PCOR 3, and there was this huge surge. And so, again, I got to go back to, you know, in Adriana's case, in a lot of young people's case, they're not doing anything more than what the government has allowed. Remember, the government said, hey, gather in 50, hey, gather in 25, hey, go to open the bars. Remember, so Adriana and other young people and everyone else was doing what the government allowed. So it's really hard to pin any kind of fault on that. Look at it this way, right? If the speed limit's 65 or 55 or 35, are you going to go 35? No, you're going to go, you know, 55. I mean, you're just going to exceed whatever the government allows. So it's not your fault, Bree. I get where you're coming from. I know that, you know, we're a family here. We're a close-knit family. There are people who work with us who are elderly, who have, you know, pre-existing conditions. So I get why you want to beat yourself up over it. And I mean, but again, you're human. We're supposed to feel these things. And I mean, I just got to say, you're doing the best job that you can. And, you know, that has kind of been your center this whole pandemic, Bree. You've been concerned about the staff, who can come in, who's got a condition, who's susceptible to this thing. And, you know, you've adjusted our staffing accordingly. So you've done the best. And I don't want to, I mean, I think it's normal for us to cry. This is like the biggest show for cry. I've already cried this morning on the air. I mean, So yeah, we wear our heart on our sleeves, guys, and thank you so much for your prayers and your thoughts. We're gonna go get tested. Obviously, there's just a lot of, Bree's, got her son. I got my kids. I mean, they interact with their elderly relatives, so we're very fortunate that we're able to go and get tested here. And guys, the stigma for testing, you really got to just go and do your part. And we see again why businesses come out and come forward and share that they have positive cases. Because we're in this lurch, right? So we found out Saturday night, we had no contact from public health. It's Sunday, but we're in a position where we're going on the air Monday morning, and we had the conversation. What are we going to do? Mm-hmm. Are we going to tell people? And of course we're going to tell you guys. We tell you guys everything. We call for transparency from, the highest levels of government, and what kind of organization would we be if we did that without also applying it to ourselves? So, I mean, it's tough. You okay?
Yeah, I'm fine.
Okay.
We have a long day.
Yeah, we do. We got a whole show to get to. So we'll take a short break, and we're coming back. We're a little bit backed up. I want to thank Father Paul. He's going to come on and talk about the church. Maria Pangolin from the Guam Election Commission going to come on and tell us what's in stake for the primary election at 7 o'clock.